I'm the founder of Hope Interventions. We focus on intervention services for all kinds of addictive disorders, including mental health crises. Usually what happens immediately following a successful intervention is I work with the individual and direct them immediately to treatment. So I provide the transport and take them directly to treatment. I stay with them while they go through the admissions process, and I sort of handhold them so that they feel safe. I then act as a liaison with the treatment provider and the family members. I let the family members know that there's been a safe transition, and I continue to support the family members for months after the intervention. I establish referral relationships well before I ever work with a particular family. And before we ever sit down and engage an intervention process, we've already made an assessment and determined the appropriate treatment placement. And what I think makes a great treatment provider is individualized care. I want a small treatment provider, I want an intimate setting, and I want a provider that's really looking at a person as an individual and not a statistic. And I don't want one-size-fits-all cookie-cutter treatment. I want a treatment provider that uses evidence-based or outcomes-based practices. My relationship with Bridges to Recovery has developed over the last several years. Bridges to Recovery is an extremely unique provider in that they are psychiatric treatment in a residential setting. They're one of a kind. Bridges to Recovery is so dedicated to making sure that there is a smooth transition for the client coming into treatment, that they will go to great lengths to make sure that that client feels supported and gets there safely and comfortably. They don't want to put any barriers between the client and treatment. My experience referring clients to Bridges to Recovery has been stellar. From the initial phone calls with the admissions department, determining and assessing whether it's the appropriate treatment. One of the key benefits is their diligence in determining that they are the right place. They won't take clients when they feel that that client needs a higher level of care, so I believe there's a lot of integrity there. Another key benefit for those of us who are client-focused is the level of therapeutic services that they provide. They have such a great team of clinicians, and they match their clinicians to their clients, so they're making sure that the clients are well served all the way through to discharge and aftercare planning. Bridges to Recovery focuses on every detail, really addresses each individual's needs, helps me communicate with families and keep the families active in the process. I understand that there's a fear among clinicians that if they send their client directly to residential treatment, especially if the focus of treatment is psychiatric, that they may lose their client, that the client may then be diverted to other clinicians and may never come back. And my experience at Bridges is completely the opposite. They know that the client has established a great relationship with their therapist, and they also know that the therapist is a wealth of information, that the therapist can help them provide the best care that they can with their history and their relationship with the client. So it's important that they foster the relationship with the therapist, and that's been my experience. My feeling is that the kinds of clients that go to Bridges are a really vulnerable population when we're looking at acute mental illness, whether that's depression, whether that's OCD, whether that's anxiety. And that vulnerable population really needs to feel safe and really needs to feel contained and really needs to feel cared for. And my experience at Bridges is that they provide all of those things.